I'd like to talk to you for a second about Neurassage. Neurassage is a combination therapy that uses generally regular massage techniques in combination with high pulse electrical therapy. If you imagine for a second that you had an electrical device that is FDA cleared and approved for the treatment of pain and vascular stimulation, which the device we're using has been for nearly 40 years in the market. So it's an established treatment modality for pain already in the pain space. The difference is that we are now taking that electrical therapy that normally you would go into a doctor's office and have the doctor, hook the machine up to you and run a treatment for you. In this case, we're not doing that. What we're doing instead is we are taking the device and we are basically making a circuit out of the massage therapist and the patient or the client, right? So what would happen is that a simple, electrical cord connects the client or the patient on a massage table. They're laying there like normal. You put the pad under the patient and they just lay on top of it. And then the other pad would, go on the therapist. And then the device is turned on and you now have an electric current that is live and active. And when you go down to start performing the massage and you're digging into the muscle areas and the joints and into that soft tissue, you're delivering high pulse electrical current directly into those tissues. The report that patients and clients give back for this is that it feels amazing. The high pulse electrical therapy is it produces what's called depolarization of pain neurons. So what it's doing is just depolarizing pain neurons and it's creating this pain relief effect. There's a triple combination of neurotransmitters and neuropeptides that are being released when you depolarize these pain neurons. One of them is endorphins, the other is enkephalins, and the other is GABA. And all three of these neurotransmitters, they perform quite a number of things. But I've had several doctors I've worked with over the years. Some of them are experts in neurotransmitter combinations, neurotransmitter knowledge. And they describe this as basically an electrically induced runner's high. If you would imagine the way you feel after you work out, you feel great after you work out. You feel great after, a good run, right? Some of you may not know what that feels like, but after a good run, you just feel good. It's a very natural, healthy feeling, but you feel great and you sleep better that night. So typically, and then so that's called a runner's high, and a lot of people get really what do you call it? Used to engaging in that. They love to work out. They love the way that feels because they feel healthy and good. And it produces so many positive outcomes. Well, this is performing a very similar function. You're receiving this deep, massage. Now, keep in mind, because of the electrical current, by the way, it doesn't hurt. It's in most cases you will not feel the current at all. But because of the current, you don't really have to. The therapist doesn't really have to dig down like they would before to try and produce an effect. In fact, what they might do is simply, if you say, I'm using a thumb as an example, and I'm not a licensed massage therapist, so I work with many of them, so I'm just using some of the knowledge from talking to them. But if you were to find a pain spot, like in a back, if you're doing a back, massage or a back neurassage for a back pain issue, then you can go right to where that spot is, and you can press in and hold. And you press in and hold for a second, and that electrical current is going right to the issue that is causing pain. And you can let it sit there for a few seconds to induce the effect. But overall, a full body neurassage would make someone feel amazing. And I've had it myself, and it is amazing. One of my trainers for this, who works with us and trains other therapists around the country, she's been doing this for many years and ultimately has the exact same clientele of people who want to come in and get this done on a regular basis. Most of her, I mean, she's booked out for months. Most of her clients are repeat people that have just really gotten to enjoy this type of massage rather than the traditional massage, because this just produces so much more medical beneficiary outcome. So some of the positive side effects of this. One, you get the positive side effect of a regular massage. So that's number one. You're going to feel great after a massage anyway. Now you're going to feel even better after a neurassage. Number two, that depolarization with all those neurotransmitters, it produces a range of positive benefits. So that's the other benefit, of course, of the neurassage. The third one is, because of those neurotransmitters and all that, you're probably going to sleep better that night. So a lot of people will report that they are sleeping better after getting treatments like this and after getting this neurassage. You're also probably going to start to see improvements in a range of physiologic issues. Um, there's a lot of positive outcomes. And the GABA molecule alone produces what's called a vascular permeability, which assists in fluid transfer between tissues and vessels, helps helps clean out inflammation and edema and all that stuff in different parts of the body. So that GABA molecule that's being released produces quite a few outcomes. It also helps. That's part of why probably people sleep better, because that is a very strong sleep associated neurotransmitter, and also too cardiovascular functions improve generally, just because that GABA molecule is producing that vascular permeability. We've seen a lot of benefits occur from that. None of these benefits are promises or any sort of medical claim being made. It's just we know that the electrical current induces this depolarization effect. We know that it releases these neurotransmitters, and then we know that these neurotransmitters produce a range of benefits. So I'm just pointing out a few of the benefits people have noted to us, and typically sleep is the first one people notice. On top of that, getting out of pain, right? So most people do notice they get out of pain and that they start sleeping better, and everything after that starts getting better. So we want to point that out to people. The treatment itself is it's just amazing. There's nothing else like it. And again, there may be some similar types of therapies out there that are using a manual application for some electrical type of therapy, but there's nothing else like Neurassage, not like this, because we have a high pulse electrical current that is producing this outcome. So I wanted to chat with you about that, let you know what this is, help you get excited about doing this, and I want you to try this. I think everyone out there should. There is a very small and short screening sheet you'll have to fill out, just because this is not a regular massage. So there's a couple of quick medical questions to ask, but that's about it. And I'd be very happy to hear about your experience with this, and I'm sure your neurosage therapist would love to hear your positive experiences as well. I look forward to talking to you again soon, and good luck getting your neurosage. Thank you.